This medication is used to treat symptoms caused by the common cold, flu, allergies, hay fever, or other breathing illnesses such as sinusitis or bronchitis. It contains dextromethorphan, which helps to suppress coughing by affecting a certain part of the brain. It also contains decongestants to relieve stuffy nose symptoms, and antihistamines to relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It's important to note that this medication has not been shown to be safe or effective for children under 6 years old, and some forms of this medication are not recommended for children under 12 years old. Always consult with your doctor or pharmacist for more information on using this product safely. Remember, this medication does not cure or shorten the length of the common cold and may cause serious side effects if not used correctly. Be sure to follow all dosage directions carefully and avoid giving this product to make a child sleepy. Also, be cautious of giving other cough and cold medications that may contain the same or similar ingredients. It's best to consult with a doctor or pharmacist for other ways to relieve cough and cold symptoms, such as staying hydrated, using a humidifier, or using saline nose drops/spray. When taking Alahist DM, Pheniramine, 12.5 mg, 5 mg, 10 mg/5 ml oral liquid antitussives, be sure to carefully follow the directions on the product package. If you have any questions, it's best to consult your pharmacist. You can take this medication by mouth with or without food, and it's important to drink a full glass of water with it. If you experience stomach upset, you can take it with food or milk. If you're using the liquid form, make sure to use a medication measuring device to measure the prescribed dose. Don't use a household spoon, and if it's a suspension, be sure to shake the bottle well before each dose. For extended-release capsules, swallow them whole and do not crush or chew them. The same goes for extended-release tablets, unless they have a score line and your doctor or pharmacist tells you to split them. Chewable forms of this medication should be chewed thoroughly before swallowing, and if you're taking the powder form, make sure to mix it thoroughly in the proper amount of liquid and drink it all right away. Do not prepare a supply for future use. The dosage of Alahist DM is based on your age, medical condition, and how you respond to the therapy. If you're taking it for allergy or hay fever symptoms, it's best to take it regularly to get the most benefit from it. It's important not to misuse this medication, as it can result in serious harm. Do not increase your dose, take it more often, or use it for a longer time than directed. If your condition lasts or gets worse, be sure to tell your doctor. Some common side effects of Alahist DM, Pheniramine, oral liquid antitussive include drowsiness, dizziness, headache, blurred vision, upset stomach, nausea, constipation, or dry mouth/nose/throat. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist promptly. To relieve dry mouth, you can suck on sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. It is important to note that this medication can dry up and thicken mucus in your lungs, making it more difficult to breathe and clear your lungs. To help prevent this effect, it is recommended to drink plenty of fluids unless otherwise directed by your doctor. In order to reduce the risk of dizziness and lightheadedness, it is advised to get up slowly when rising from a sitting or lying position. If your doctor has prescribed this medication, it is because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, if you experience any serious side effects such as mental/mood changes, ringing in the ears, shaking, trouble urinating, weakness, easy bruising/bleeding, fast/slow/irregular heartbeat, or seizure, it is important to inform your doctor right away. Although very rare, a serious allergic reaction to this drug is possible. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, it is crucial to seek medical help immediately. It is important to note that this is not a complete list of possible side effects, and if you notice any other effects not listed above, you should contact your doctor or pharmacist. Before using Alahist DM, Pheniramine, 12.5 mg, 5 mg, 10 mg/5 ml oral liquid antitussives, it's important to tell your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's essential to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have any breathing problems, diabetes, eye problems, heart problems, high blood pressure, kidney problems, liver disease, seizures, stomach/intestinal problems, overactive thyroid, or urination problems. This medication may cause dizziness, drowsiness, or blurred vision. It's important to be cautious when using alcohol or marijuana, as they can increase these effects. Avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. Limit alcoholic beverages and consult your doctor if you are using marijuana. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, it's important to consult your doctor or pharmacist about the safe use of this medicine, as it may contain aspartame. Liquid preparations of this product may contain sugar and/or alcohol, so caution is advised if you have diabetes, alcohol dependence, or liver disease. Consult your doctor or pharmacist about the safe use of this product. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially dizziness, drowsiness, mental/mood changes, constipation, fast heartbeat, trouble urinating, or blood pressure changes. Dizziness, drowsiness, and confusion can increase the risk of falling. Children may be more sensitive to the side effects of antihistamines, and in young children, this medication may cause agitation or excitement instead of drowsiness. During pregnancy, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. Additionally, this medication may pass into breast milk, so it's important to consult your doctor before breastfeeding. When taking Alahist DM, Pheniramine, oral liquid antitussives, it's important to be aware of potential drug interactions. This includes medications that could change how Alahist DM works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Avoid taking certain MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. It's also important to be cautious with other drugs that cause drowsiness, including opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, and other antihistamines. Additionally, be mindful of other products that may interact with Alahist DM, such as antihistamines applied to the skin and rolapitant. Always check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. It's also crucial to inform your doctor and lab personnel if you are taking Alahist DM, as it may interfere with certain medical or lab tests, potentially causing false results. Always consult with your doctor or pharmacist before starting, stopping, or changing the dosage of any medicines while taking Alahist DM. If you suspect an overdose and the person is experiencing severe symptoms such as passing out or difficulty breathing, it's crucial to call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can reach your local poison control center at 1-800-222-1222. For Canadian residents, call a provincial poison control center. Symptoms of an overdose may include agitation, confusion, flushing, hallucinations, enlarged pupils, muscle twitching, and seizures. In children, excitement may be the initial symptom, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. If your doctor has given you a prescription for Alahist DM, Pheniramine, 12.5 mg, 5 mg, 10 mg/5 ml oral liquid antitussives, it's important to follow their instructions and not share the medication with others. Remember to attend all of your medical and lab appointments as advised by your doctor. This will ensure that you are receiving the proper care and monitoring while taking this medication. If you are taking Alahist DM on a regular schedule and you forget a dose, take it as soon as you remember. If it is close to the time for your next dose, skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. When storing Alahist DM oral liquid antitussive, make sure to keep it at room temperature and away from light and moisture. It's important to avoid storing it in the bathroom, and do not freeze the liquid form. Keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard the medication when it is expired or no longer needed. For guidance on how to dispose of it, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.